You're tuned in to The Andrew Lawton Show.
In medicine, referral means something very specific. And I saw this addressed by Dr. Shawn Whatley on Twitter, and I wanted to bring him on the show because I want people to realize why this so-called duty to refer, this requirement of providing a referral, is in fact a violation of the conscience rights that need to be upheld by doctors and for doctors and other healthcare practitioners. Shawn Whatley is the Health Policy Fellow at the Macdonald-Laurier Institute and the author of the fantastic book, When Politics Comes Before Patients. Shawn, good to talk to you as always. Thanks for coming on today.
Thank you, Andrew.
So the last few days of the campaign, the conscience rights question has come up. The Conservative platform initially said it was going to protect conscience rights for healthcare practitioners, cue Liberal backlash. You fast forward a couple of days, and Erin O'Toole has walked it back slightly, saying, yes, we won't make anyone do anything except for refer. Now, this would, to a lot of people, seem like a completely reasonable compromise, but I saw some of your tweets on this, and I've heard healthcare practitioners bring this up before. And the idea of merely referring something like an abortion or an assisted death is not as benign as it's made out to be. Explain this.
So I'm glad you brought this to the focus of referral. I think a lot of patients assume that referral is just kind of like telling people information. And actually, when you look at what patients want, and I've seen polling data on this, hopefully it'll come out over the next little while, that patients are actually very supportive of their doctors talking to them about things. And I think all doctors want to do this. Let's talk about all the options. Here's the pros and cons of this direction, that direction. How does it fit with you? But when you actually start talking about making a referral, so a medical referral is when I refer you for a procedure that I think is going to be good or help you. You need your gallbladder out. Okay, so I think you need your gallbladder out. That's my professional opinion. I'm going to refer you to a specialist whom I trust to do a good job, so someone that I respect. An effective referral flips the whole concept on its head. I am now referring you, sending you for something that I don't think is actually going to help you. I actually think you need antidepressants for 6 months, or I think you need better palliative care or pain relief or something else. So I don't actually think ending your life is a good thing for you. So now I'm sending you for something that I don't think is good to someone that I'm not sure I agree with their approach to medicine, and nor do I hold them in high respect. So now I'm in intimate connection with this therapeutic chain of events that leads towards something that I fundamentally don't agree with. And to be clear, this isn't about freedom of religion. It's about freedom of conscience. And so the debate has been framed in such a way that it's very hard to win that debate, right? A tiny group of people who want to practice their religion versus all these patients who just want medical care. Well, everybody's going to say, well, yeah, I don't share your religious beliefs. Why should you impose them on me? That has framed the debate incorrectly. And I can unpack that for you if you want, but I'm not sure if that's where you want to go in this interview.
Actually, I would like to, but just if I can interject for a moment here, I know when my old family doctor retired, for example, it was his daughter that took over the practice. So you have generation removed between the one doctor and the other. And even in that, there were some slight changes. Now, it's not like all of a sudden, we fundamentally inverted, what medicine looks like in this clinic, but each of them has their own approach to certain things. And I know that from doctor to doctor, that's probably pretty common. So the idea of, in general, trying to take away a doctor's right to do what's best for their patient in their eyes, which is why they got into medicine, seems like a very dangerous precedent.
Yeah, so really you're going where I wanted to go exactly. So you're talking about what function does freedom of conscience? We don't usually use those words, but that's what you're getting at. So the basis of a profession, certainly in medicine, but also in education, in law enforcement, all over the place, you need people to be able to make free and informed decisions on their own in a professional role when they don't have solid evidence either way. So many of the things that we suggest in medicine don't have evidence-based support for them yet. So for example, your child falls off a tricycle, hits her head on the ground, and I see you in the emerge, and you say, my wife sent me in. That's what usually happens, right, when the dad's in the emerge. My wife sent me in, and she said, get a CAT scan of my daughter's head or whatever. And so we're there discussing, and I'm saying, you know what, there's no literature to support CAT scans for every little child who bumps her head. And I think we should take a different approach. Furthermore, these are the risks of having, doses of radiation on your brain, et cetera. And you say, no, I really want this. And so it becomes a debate of, and you may even have evidence on your side. You might say, well, actually, modern CT scans are very low dose radiation, and you might compare them to flying in an airplane. And so we have an actual data-based discussion. But at the end of it, I need to be able to have the freedom to say, based on my experience and based on my concern for your health, not only today, but 60, 70, 80 years from now, I don't think this is the best direction to go. So that's sort of how freedom of conscience fits into the basis of professions. And that's where the debate needs to happen, because we're talking about painkillers and parking stickers and CT scans for kids' heads. And you just go all day long in the clinic. I'm asked to make decisions. So physicians, family docs in Canada are gatekeepers for the healthcare system. So to be a gatekeeper, yes, you are informed by evidence, but often you're informed by experience. And you say, you know what, I think the likelihood of you needing another MRI for your anterior knee pain is 0. It's not going to tell us anything. And the patient will say, well, prove it. Well, I can't prove it. And so now I'm making a decision for you based on the absence of evidence, but I'm basing it on professional experience. And this is core to freedom of conscience. So that's where the debate needs to happen, at least on the professional side.
And I think those are all completely valid examples, but there are also moral aspects to this, and there are also religious aspects to this. You have some doctors that may have an aversion to birth control or abortion, or in a more, I think, modern example, we know that this liberal bill on assisted suicide could extend to people with mental illnesses, and I know there are going to be a lot of doctors that have issues with that. How do you navigate that aspect of it? Because, this is, again, an example that may or may not have happened, but if you were to have a Jehovah's Witness doctor who doesn't like blood transfusions, I mean, where is that squaring with the professional side of things that you've just laid out?
Yeah, so I'm glad you threw up at the opening in the introducing this segment. You said, oh, here we go. We already have abortion into the election campaign. So I'll use that as an example first. We always hear this. We say, oh, people are going to be blocked from getting abortion if we allow docs to act based on their freedom of religion or freedom of conscience in this particular case. That is a red herring. That is just so wrong. We have had decades of direct access to abortion in Ontario. So when you describe the access, the access is outstanding. It is fantastic. You can access abortion more easily than almost any other medical procedure in Ontario right now, because you don't have to go through any gatekeeping. If you need one, you want one, you just go get one directly. So to say that, oh no, now Andrew, your freedom of religion, conscience, thought, whatever is going to prevent me from accessing abortion is simply not true in reality. So now when we expand this to medical aid in dying, voluntary assisted suicide, or any other procedure that society has decided that we are going to provide within our medical system, to set this up as a straw man to say, oh, look, now you're going to block me from it. If the state has made a promise to provide a particular procedure, then the state needs to make sure it can provide that access without forcing docs to be involved with it. We have over 25,000 practicing physicians, 24 to 25,000 practicing physicians in Ontario. The Ministry of Health, I was just talking with a civil servant just recently, they said they have less than 700 docs right now in Ontario who have been involved with medical aid in dying. And many of them, once they do it once, they say, you know what, this is too heavy. I can't, the emotional burden of me doing this, I don't want to make this part of my practice. These are people who support it and are actually being involved with it. So we're going to have a major problem of having even enough physicians available and ready and willing to do the procedure. And so to start talking about, compromising freedom of conscience or a physician's ability to say, no, I don't feel comfortable with this, is a major issue. And I think we need to have this baked into legislation. We need to be able to protect docs. And I would say the vast majority of physicians and voters would agree in that direction.
To go back to this idea of the referral, if someone were to go to their family doctor who has a conscience-based objection to something, and the patient says, I want this thing, if the doctor were to say, I don't do that, I have an objection to it, but call this person, that's not a referral, correct?
That is not a referral. You could also talk about a total transfers of care, but actually that concept of total transfers of care is used by the courts to say, oh, you just are trying to abandon your patients now. So actually the people who are against being forced to refer are very, very clear about saying, we're not talking about transferring all care. We don't want to abandon our patients. We want to stay with our patients, as long as they want to be with us. But telling them, there's a number to call or you can reach out. And to be clear, these are healthy people. When you're talking about euthanasia or medical aid in dying, these are healthy people who've already called your clinic and made an appointment and walked into your clinic and will walk out of your clinic. So these are ambulatory healthy people. We're not talking about the in-hospital situation. We can unpack that if you want later. But simply saying, yes, that's how you access. There's a 1-800 number, there's a website, or the local urgent care staffed by public health nurses does it, or the community care health center. Wherever it is, people are generally very okay with saying, yeah, that's how you access it.
When the Liberals are coming out and making that comment that Justin Trudeau made last week, freedom of choice doesn't mean the freedom for a doctor to choose. How do you respond to that as a physician?
Yeah. So again, he's framing it as a debate about competing rights and specifically a freedom of religion versus the access to care, which is a total straw man. And so we have to understand what exactly is freedom of conscience, and then how does it apply to our system of government and to professions. We've already unpacked how it applies to professions, but I'll read to you from a Supreme Court of Canada case, 1993, right? Rodriguez case. This is Antonia Lammer saying here, quote, an emphasis on individual conscience and individual judgment also lies at the heart of our democratic political tradition. The ability of each citizen to make free and informed decisions is the absolute prerequisite for the legitimacy, acceptability, and efficacy of our system of self-government. And then more recently in 2009, Justice Abella, again, Supreme Court of Canada, quoting a European case, said, quote, freedom of thought, conscience, and religion, so she clumps them all together this time, is one of the foundations of a democratic society. It is one of the most vital elements that go up to make the identity of believers and their conception of life, but it is also a precious asset for atheists, agnostics, skeptics, and the unconcerned. The pluralism indissociable from a democratic society which depends upon it. So this is the Supreme Court of Canada saying this is the prerequisite for democratic society. And so for Justin Trudeau to be throwing this out on a campaign and saying, oh yeah, it's his rights against her rights, and that is just so wrong, and he knows it, or he should know it.
Dr. Shawn Whatley, author of the book When Politics Comes Before Patients, also health policy fellow over at the Macdonald-Laurier Institute. Shawn, always a pleasure. Thanks for coming on today.
Thanks again, Andrew.
Dr. Shawn Whatley, always a pleasure. We've got to end things here. My thanks to you all for tuning into the program today. Canada's most irreverent talk show. You can keep up with all of our election coverage over at tnc.news. We'll be back with another edition of the program in just a couple of days' time. Thank you, God bless, and good day to you all.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.